Hello, friends. This is Dr. Ashley, and this month, February, is Children's Dental Health Month. And so we are introducing Dr. Krista Geisler from Life Smiles and also.
Release and Breathe Dentistry.
And so today we're going to ask her some important things about children's dentistry and how that plays a big role in children's health. So she's going to tell us all about that now.
Yeah, it's important for kids to come to the dentist by their first visit by age 1, which most people don't know. Like our generation, that didn't happen. But we want to prevent problems and think about it as a well baby check, but in an oral way. Your mouth is not a separate part from your body. It's your whole body health. And it's very possible to keep kids cavity free. And the more we know about that and prevent it early, the better the chance they can be cavity free the rest of their life. So early start is the best thing for them.
Awesome. And then on top of normal and regular children's dental health, when we talk about breathing and feeding, airway, speech, what other things can affect kiddos that we want to look at early on, shortly after birth or at any point?
Yeah, and that's something that I focus on a lot is shortly after birth, there's sometimes some feeding problems or what people would call colic, but fussy baby, lots of tension in their body. So I'm one of the dentists who does infant exams and new baby exams for tongue and lip and cheek ties. So that's important to check out. But also like that tension, if you do have tension in the floor of your mouth, it's going to affect how you posture and how you walk in your development. So it's important to look at all of that. And for kids, I can look at a child's face and their profile, and I can tell you if they're breathing well or not, or what they're doing when they're sleeping. Sometimes I'm just watching a show and I'm like, oh, that kid has sleep apnea and wets their bed and isn't studying well in school or focusing well in school because they have all the signs, physical signs. So as soon as I learned about this stuff, you can't unsee it. And so I see it and I have to talk to parents about how what I see relates to their breathing.
Wonderful. And then tell us a little bit about when we should look at the tongue, cheek, lip tie areas, even if it's not necessarily affecting feeding. Should we still look at and evaluate for that?
Yeah, and some of the signs are like reflux. Is the physician thinking about putting you on medication, the baby on medication? That might be a sign of it. If the chiropractor or the body worker is not seeing success with their treatments and they're not holding. Those are some signs. And then when they hit solids, that's a whole new level of using your tongue and function. So they're really struggling with solids. They have a really strong gag reflex. If their mouth is open, that's the number one thing. If their mouth is open, we should check them out and see what we can do because babies are always supposed to be breathing through their nose.
And what about sleeping? Like, are there things when they're asleep that we can watch for that could show signs?
Right. First of all, we want the lips together and not snoring, and we want them like in a comfortable posture. Some babies are sleeping with their head hyperextended, which means they're trying to open the airway. Babies are never supposed to snore. It means there's an obstruction to their breathing. It's never normal for kids to snore. So those are things we're looking for with little babies.
Okay. And then tell us a little bit about what's different working with your practice and with you as opposed to maybe a traditional dentist or dentist that maybe someone else has worked with before.
Yeah. So pediatricians and dentists both agree that babies should have their first dental visit by age 1, but still a lot of people aren't comfortable with infants. So they might call you on the phone and the receptionist says, oh, they don't need to be seen until age 3. So that's not the practice that sees kids. And what's different about me is I am seeing them like within the first week of life often if there's ties concern. But I see how their jaw is growing and developing, which is not what I always saw. So once I've learned about airway, I can't unsee it. So we're educating parents and they're like, oh my gosh, I didn't know all of this stuff made sense and it's connecting all the dots for them. So I think I have a deeper look into the whole body health, not just looking at teeth.
Beautiful. And then is there anything specific that you think, other than what we've talked about, is important for parents to know? Also, do you only see kiddos?
I see infants through adults, so I'm a general dentist. Something I want parents to know. I think bringing your child to the dentist is part of like a wellness, like whole body, bringing your child to get adjustments, even if they're not ill, like keeping them healthy can happen, but you have to be, active and bring them to the dentist, not just bring them if you see a big brown hole in their tooth or if they're having pain. So I think it's part of just general wellness is taking care of your mouth.
Wonderful.
Mm.
And then very last thing, I know that there are things with the teeth and with dental health that literally affect, or you can see signs in the
Mhm.
body. I know that there's a mouth and heart connection and
Mhm.
those kind of things. Do you see very much of that in your practice where people who aren't feeling very well, we also see some dental health things that we need to focus
Yeah,
on?
yeah. And so I see, the first thing is I see a lot of people grinding their teeth and children grinding their teeth. That's a breathing and sleep issue, and that always relates to your heart and your, how well your brain is functioning during the day. And a lot of people have gum disease. They're not taking good care of their gums, and it's harder to control their blood sugars. It puts them at higher risk for having cardiovascular disease. So all these things, if we can keep you healthy or keep you on a wellness track, is in your best interest.
Perfect. Thank you so much for sharing that with
Mhm.
us.
Thank you.
We love to have all of our community resources be available to all of our parents, and it's nice when they get
Mhm.
to meet you
Yeah,
and
thank you.
see you.
Thank you, Dr. Ashley.
You're welcome. Have a great day.